But I remember talking to you the last time that one of the things I almost anticipated was once this grew in, I knew you'd be happy with it. But one of the thoughts, and I knew it at the time when we talked about it, was at least coming in and filling in those corners a little bit. Okay,
Right.
so I'm just going to kind of draw on that just so I can see as well. Once I'm done drawing this, we'll review it again, and so we're going to come in and just fill in that corner a little bit more for you, just to blend it into your side. We have a little bit in there. We want it a little bit thicker. One of the other things also, Bob, is when you comb your hair back like you are, the thing that obviously everybody sees is that hairline. I look at this every day. I would venture to say, nobody's picking out, as you said, nobody's picking out the fact that you had transplants. But again, you really want to, always kind of do a little bit on that hairline. So I'm going to, again, trace your hairline out, just like that. And then again, we want to get this side as well. But I'm probably going to come in and just work this hairline just a little bit for us. One of the other things I'm going to do, Bob, is I'm just going to kind of look around here a little bit for areas that I see. So as I kind of comb your hair back, I like the corner in here, up in here just a little bit, okay? So, because you can see as I open that up, you're showing just a little bit in here. So I think I want to do that. So it literally will start here and just go right here.
Yeah.
Okay.
Yeah.
And then, like I said, I'll get that scar out. And
That'll probably be better right in the middle because I won't have as much tension on just in the center.
Your last sessions prior to today have given you about 3,000 grafts.
Right.
3,000 grafts certainly has given you a good look, because I would venture to say what you have, at least in your frontal half of your scalp, is all grafted hair. So 3,000 grafts has worked very well for you with your skin and hair color, keeping in mind everybody's different. Now, even though you have a good look, today in our effort to try and clean this up a little bit, fine-tune things, give you more volume, our goal today is approximately 1,800 grafts.
Okay.
Now, keeping in mind that 1,800 grafts, again, is our goal, but one of the things we're trying to do in that back area is we're also going to be trying to take out the previous scar. The objective with every surgery is to always take out the previous scar, so you're only left with one scar back there. What I'm going to do is I'm going to have the nurse come in, get you dressed appropriately, get you set for surgery, and we'll go to work.
Okay, I'm ready.
These are the medications we normally give. I just want to make sure, are you driving after the procedure, or is somebody here to drive you home, or somebody picking you up?
I'm driving myself.
Okay. So basically what we're going to do then, since you're driving, we're not going to give you any of the Valium because we don't want to have you drowsy and driving home.
All right.
So what I'm going to give you today is an antibiotic. The two red ones are an antibiotic called Keflex. They're just kind of preventative. And the two white ones are prednisone to help with any of the swelling.
Okay.
And you will get a prescription whenever you leave here to continue with these medications.
Okay, Bob. Bob, all we're doing right now is we're just taping up your hair up out of the way, okay? And the reason for that is because once we're done taking that little piece of skin back here, then we'll be able to take the tape off, and your hair will very easily cover that up for us, okay?
Okay.
The next thing you're going to do is you're going to feel, I am going to shave a little bit back here, so you'll feel the shaver kind of vibrating a little bit. Don't get nervous. I used to be a barber in a previous life, and here we go. One of the things I like to encourage all of our patients is good communication. If you need anything at all, just ask. If you need to stand, stretch, if you need some water, bathroom, anything at all, just ask, okay?
Yep.
Again, that seems to work the best. Next thing you're going to feel is a little bit of cold. We have a little bit of alcohol and cleaner that we used for the back area. Good. Okay. And now we're going to put a bandage on you, Bob. The bandage just kind of keeps the sprays that we use out of your eyes. When you leave here, there will be no bandages. You'll leave the way that you came in. Okay, just like that. And again, I would encourage you, if you need anything at all, if you want me to order out for pizza, we can do that.
Hoagies?
Hoagies as well, anything that you want. You are going to feel a little pinch. just like this. Pinch on the count of 3. 1, 2, 3. Bob, I would venture to say that you're starting to even like this a little. We're going to sit back and just give it a little extra time, and so we're not in a hurry here. We'll just take our time here, make sure you're good. And when I get started here, Bob, you shouldn't really, you'll feel me touching you and pushing, but you shouldn't feel any pain, okay? If you feel any pain, the worst it's going to be is a little pinch, and you need to tell me, okay?
Okay.
We're not here to, torture you. We want to make this as pleasant as we can.
Are you doing okay, Bob?
Yep, I'm doing fine.
We'll ask it out 1,000 times.
Okay. I will tell you, all the hair is out. Now all we're going to do now is just put some stitches in.
Okay.
And Nurse Lisa gives you a hard time. Just
Well, got to make sure you're well cared for.